Project Sonar has been a passion of mine now for about 4 years. It all began back in around 2011 when I took over the chairmanship of a committee in the AGA called the Practice Management and Economics Committee. It was clear at the time that gastroenterologists needed to pivot away from fee-for-service focuses on colonoscopy and move into non-procedural lines of business. At the time, the next most significant business line in GI was, and still is, inflammatory bowel disease. So we focused on trying to build a line of business around inflammatory bowel disease. My first step was to go to our major payer, Blue Cross Blue Shield Illinois, and I just was asking for cost data because I wanted to know what is the total cost of care for patients with Crohn's disease. Well, after a while, they finally agreed to provide me data, and they provided me 2 years of claims data on 21,000 patients. And it was very clear after looking at that data that we had significant patient management issues and much more significant patient engagement issues. We needed a sonar system to ping patients in between their face-to-face visits because less than a third of the patients who went into a hospital for a complication had any evidence of a doctor encounter in the 30 days before they were admitted. And over half the cost of care in that patient population was for these complications. So we needed a way to ping these patients in between their face-to-face visits so that we knew how they were doing. And we needed to know that they were deteriorating even before they realized that they were. So what Project Sonar is built into the name. It's a sonar system for patient engagement using a cloud-based platform that utilizes cell phone technology to send a set of structured questions to patients on a monthly basis to bring back a sonar score. And our team of nurses then monitor the patients on the basis of their scores, and we intervene with the patients before they even realize they need to be intervened with. We've lowered the cost of care in the process. Well, we started with Crohn's disease, and Crohn's disease is a condition that involves patients who are young, 20s, 30s, 40s, and most of these patients only have Crohn's disease. They don't have comorbidities. So it lended itself very nicely to a project where we could demonstrate an outcome with a very clean result. And so we focused on Crohn's. Crohn's is I call it a high beta illness because small changes in care can result in significant changes in outcome in this population, as opposed to diabetes or high blood pressure or hypertension, where it may take years for a complication to develop. You mismanage a patient with Crohn's disease, it can have a devastating effect very quickly. So we started with Crohn's, we then expanded to ulcerative colitis, and now we have moved into irritable bowel syndrome and have plans for other illnesses to move into. Well, they came from our practice. Basically, Project Sonar is a partnership between Blue Cross Blue Shield Illinois and the Illinois Gastroenterology Group. They attributed our own patients to us for this study, and what they do is they provide us claims data every 3 months on our patients, so we know everything that's happened to our patients, every drug that they've been on, whether we prescribed it or somebody else did. And they fund us to build a care management infrastructure around these patients. So we deployed the cloud-based platform that we developed, and we deploy a team of nurse care managers that assist in the management of the patients. Every patient gets touched every month, some way. The primary results that we are presenting at the plenary session on Tuesday morning show a 9.87 decline in cost of care in this patient population we're showing over a 50% decrease in hospitalization costs, over a 50% decrease in emergency room costs. There is a slight increase in biologic expenditures, which raised our pharmaceutical costs, but in the end, that's probably what we should be doing. We should be focusing on applying the right therapy to the right patients at the right time to decrease the complications, decrease the morbidity, decrease the cost. Without the cloud-based platform, it is a very significant increase in work for the staff. Not as much for the physician, much more for our nursing staff. But the cloud-based platform allows these nurses to do this with a minimal intrusion into their everyday activity. At the beginning of the month, when the pings go out, there is some extra activity, but then this quiets down through the course of the month and really has run very efficiently for the nurses. We presented our data at an earlier conference in December. When we first started Project Sonar, we were using our patient portal. We could never get more than a 27% participation rate using the portal. But now that we're using the cloud-based platform, we have a sustained 80% response rate with the patients. The patients love it because we don't intrude in their lives. We hover over them without intruding. And by having their own nurse care managers, they basically have their own customer service representative by name that they can go to. So the patient response has been fantastic. We succeeded because we used published guidelines, we used a team-based approach to care, and we engaged the patients. Bottom line is, we can't sit back and wait for the patients to call us and expect that they're going to know when the appropriate time to call us. We need to engage them so that we can get to them before their disease does.